I don't think people understand how important it is to do research before making a big decision. A snip in time, a light-hearted look at a serious choice. Why did the person get a vasectomy? Because they were done with nappies. That's why. All jokes aside, deciding on permanent birth control is a big step. It's not something to take lightly. This essay is here to walk you through two popular options, tubal ligation and vasectomy. We'll break down the what, the how, and the why, so you can have all the info before making this life-changing decision. Remember, this essay is for information only. It's not a replacement for chatting with your doctor. They're your go-to for personalized advice. Ready to dive in? Let's get started. Saying goodbye to baby making. Your guide to permanent birth control. Permanent birth control does exactly what it says on the tin. It's a one-way ticket to preventing pregnancy, designed to be, well, permanent. We're talking about procedures like tubal ligation for women and vasectomy for men. These methods are super effective, but they're not something you jump into. Thinking about your age, if you're in a steady relationship, and your future plans for a family are all super important. In the next sections, we'll unpack each procedure in more detail. By the end, you'll have a better grasp on which one might be right for you. Let's continue, shall we? Tubal ligation. Taking control of your fertility. Let's start with tubal ligation, often called getting your tubes tied. In simple terms, it's a surgery where the fallopian tubes are blocked off. Think of it like tying a knot in a hosepipe. The eggs can't travel down to the uterus, and sperm can't reach the eggs. No meetup, no baby. This procedure is very effective, over 99% in fact. That means less than 1 in 100 women who have had a tubal ligation will get pregnant afterwards. However, like any surgery, there are things to consider. It's done under general anesthetic and requires some recovery time. Plus, it doesn't protect against sexually transmitted infections. Vasectomy. A man's choice, a couple's decision. Now let's talk about vasectomy. This is a procedure for men, and it's simpler than it sounds. It's a significant decision, but one that many couples find to be a reliable and effective form of contraception. It involves cutting and sealing the vas deferens, the tubes that carry sperm. This prevents sperm from mixing with the semen that is ejaculated. Basically, it's stopping the sperm from joining the party. Just like tubal ligation, a vasectomy is highly effective, almost 99.9% after a few months. This makes it one of the most reliable methods of birth control available. And the best part? It's usually a quick procedure, done under local anesthetic, meaning you're awake, but the area is numb. The entire process typically takes about 15 to 30 minutes. Recovery is generally faster too. Most men can return to their normal activities within a few days. But hold on, there are a few things to remember. A vasectomy doesn't offer instant protection. It takes a few months and some tests to be sure those swimmers are gone for good. You'll need to use another form of contraception until your doctor confirms the absence of sperm. And just like tubal ligation, it doesn't shield you from STIs. So it's important to continue using protection if you're at risk of sexually transmitted infections. Section 5. Weighing the options. Tubal ligation versus vasectomy. So you've heard about both procedures, but how do you decide which one is right for you? Now let's compare them side by side to help you make an informed decision. When it comes to invasiveness, tubal ligation is the bigger deal. It's a more complex surgical procedure. It involves general anesthetic and a longer recovery period, often requiring a hospital stay. Vasectomy, on the other hand, is usually a walk in the park, local anesthetic, and you're back on your feet quicker. Most men can return to normal activities within a few days. Side effects for both are usually minimal in the long run. You might experience some swelling or discomfort initially, Think some mild discomfort or bruising after the procedure. But remember, everyone's different. The big takeaway? Both procedures are safe and effective. Both tubal ligation and vasectomy are very effective for permanent birth control, with success rates over 99%. But they come with different pros and cons. Tubal ligation is more invasive but offers immediate effectiveness, while vasectomy is less invasive but requires a follow-up test. Choosing the right one depends on your individual circumstances and preferences. Consult with your healthcare provider to make the best choice for you. Section 6. Beyond the procedure, things to consider. Choosing permanent birth control isn't like picking a pair of shoes. It's a significant life-altering decision that requires careful thought and consideration. It's a big decision with long-term implications that can affect your future in ways you might not even foresee right now. Before you take the plunge, there are some crucial things to ponder. First off, your age. Age can play a significant role in your decision-making process. Are you young and possibly still figuring things out? Your life circumstances and desires might change as you grow older. Or are you older and sure about not wanting more or any children? Being certain about your decision is crucial. Your relationship status matters too. The dynamics of your relationship can influence your decision. Are you in a stable, committed relationship where both partners are on the same page? Mutual agreement is essential for such a significant choice. And finally, those future family plans. What are your long-term goals and aspirations regarding family? Are you absolutely, positively sure you don't want biological children in the future? No matter what life throws your way. This is a decision that should be made with absolute certainty. These are just a few of the big questions to ask yourself. Take your time, weigh your options, and make the choice that's right for you. Section 7. Your health, your choice. Talk to your doctor. Feeling overwhelmed? Don't worry. You're not alone. Choosing any type of birth control, especially a permanent one, can feel daunting. That's where your doctor comes in. They're like your personal guide in the world of reproductive health. They can answer all your questions, address any concerns, and help you figure out if tubal ligation, vasectomy, or another method is right for you. Remember, there's no one-size-fits-all when it comes to birth control. Your doctor will consider your medical history, lifestyle, and preferences to recommend the best option. Don't hesitate to reach out. It's their job to help you make informed decisions about your body. Section 8. Permanent birth control. A decision for a lifetime. So there you have it. A crash course on permanent birth control. We've covered tubal ligation and vasectomy, their effectiveness, pros, cons, and some key things to think about before making your choice. Remember, this decision is all about what's best for you and your future. Take your time, do your research, and most importantly, talk to your doctor. They're your best resource for making informed choices about your reproductive health. And hey, stay tuned for our next essay where we'll be tackling emergency contraception. Because sometimes life throws curveballs, and it's always good to be prepared. Don't forget to like, comment, share, subscribe, and turn on the notification button.